Growing old is obligatory. Looking old is now optional. So we'll see a little lift effect on her smile line right after this little treatment.
Abs? Are you kidding? I'm 57. The men I know that they have a pot belly. I love the pot belly.
Now's probably not a good time to tell you I don't like the cold.
Oh, it's a little late for that, Faith.
From the Zoomerplex in historic Liberty Village, The Zoomer with Faith Goldie.
Hello and welcome to The Zoomer. Today we're turning back the clock with a look at all things anti-aging. It's a quickly growing industry with treatments and products designed to help withstand the ravages of time. And apparently, the younger you start, the longer you'll look younger. So you've got my attention. Let's tee up the topic.
Every day since 2011, about 1,000 Canadians reach traditional retirement age, but many of them appear much younger than 65. So can we just chalk this up to healthier living, good diet, and exercise? Nope. Look closer at some of those youthful faces, and you'll find a growing number of wrinkle-free foreheads, or perhaps a friend will admit to having had a nip or a tuck here and there. These are the anti-agers, patrons of a growing global anti-aging industry, pulling in $200 to $300 billion a year. Japanese nightingale poo facials, confinement in ice-cold chambers, micro-needling and dermal fillers are just some of the newfangled services presently being marketed. What's more, these services are also being embraced by millennials, who are now anti-aging before they've even come of age. So, what do you think? Is this just an exercise in vanity? Or does looking younger also make us feel younger?
All right, joining us today, those in the know when it comes to anti-aging trends, people who spend their time thinking about the faces we present to the world and how to make us look our best. Dr. Mulholland, I'll start with you. These beauty treatments, some of which were just mentioned on our Kinetic, many more which you offer, are they just skin deep, or do you think that they actually have a much more profound effect?
Profound might be stretching it a bit, but study after study does show if you look good, you feel good. I don't like the term anti-aging because most people I see don't mind aging. They just want to look their best.
Right.
And so it's more pro-vitality than anti-aging. And we can do it so naturally now. It doesn't need a scalpel. It can be done subtly and executed with artistry. And I think you can, growing old is obligatory. Looking old is now optional.
Mm-hmm. Leah, you've written against a lot of these treatments publicly. Where do you stand on them, and why do you shy away from them?
Well, I have to be true to myself, and I'm very much a natural person. I like being close to nature and putting nice natural things on my skin. When I work with my clients, my male clients, I like to leave it up to them. I like to present them with options. I always present them with natural options, which always work better, and they're all quite often they're more inexpensive than going to somebody like our doctor here, and that's always a bonus too, because life is rough and money is tight quite often. So, going with a natural, more inexpensive product is always good with my guys, at least.
Wendy, you look fabulous.
Thank you.
What's your stance when it comes to these sorts of below the skin surface treatments? For, against? Are we even in a place to judge people?
I did have Botox, and I do the laser treatments and the photofacial, and I like feeling better about myself, and I feel that it's part of my lifestyle to do these things.
What are the trends out there? Are people turning more and more to these treatments, and if so, why?
Well, I think the way we look at it at Zoomer, I agree, anti-aging isn't quite the right word. It is aging in a way that makes you feel better about yourself. So inside and out. So there's diet, there's fitness, but we also believe in giving our readers the best tools, and they include technology and they include non-invasive treatments.
Now, I have found certainly, at least in the Western world, a certain timidity when it comes to talking about procedures perhaps that folks have undergone, that they're considering, and almost a judgmental tone when folks do admit to it. Dr. Mulholland, what has been your experience? Do you think that we're sort of coming out of our shells and being okay with expressing the fact that we might have had a little plumper here or a filler there?
There's much less stigma now than there used to be, particularly around the non-invasives. When we're talking about doing a photofacial or using medical skincare regimes or topical therapy or even laser treatments for tightening and soft tissue fillers. But once you get to surgical intervention, there's still a sense of, wow, even though it's extremely common, many women aren't around, the bridge table or the nuclear science meeting and talking about, do you like my scars? So there's still, there's still that sense of resorting to something unnatural to look naturally unnatural, which is to look 10 years younger than their chronological age, isn't normal. But it's unfortunately or fortunately where we've come.
Okay, so if you'll follow me over to our demo area where we have a lovely volunteer here in Ziggy. What sorts of procedures have you undergone before? Is this a first time for you?
No, I've had Botox before. It was actually a gift from my 93-year-old mother. She said, oh, you're looking a little rough, dear. And I wasn't sure how it would work out, whether it was painful. I think pain is the thing that most women worry about. But it was just a little pinch, and I felt really rejuvenated afterwards, and I looked fresh. I was really happy.
All right, so Dr.
Yes.
Mulholland, what are we going to be doing with Ziggy today?
One of the most commonly injected areas we'll do today is right here, the frown area. And so Botox is a simple protein, very safe when done properly. And so very careful to rest the individual with their head back. We take a little bit of Botox and we can very delicately rotate that in. So patients literally put on their makeup right after their Botox injection, even their filler injection, and they can go right back to work. We hold a little bit of pressure. It looks kind of painful, and I tell people when they come the first time, is this going to hurt? I say, no, it's going to be a little aesthetically acceptable discomfort.
Ziggy, did it hurt for you?
No, the dentist is worse.
The second most common area that we use Botox is then for the character lines, and that's the key. These lines right here on the side, they are characters. We don't want to eliminate them. The key with Botox is softening and having what I would call that no Botox look, where you look soft, you look vital, but you don't look paralyzed, a sort of 1999 Nicole Kidman expression is not usually the goal of what we're trying to do.
So will we see instantaneous results?
Not with Botox. Botox takes a little time to work its way down to the muscle, and within 3 days, most patients can see softening of the lines that bother them. By 6 days, it's fully effective, and generally it lasts about 6 months. What this will do for Ziggy is it'll soften her brow, it'll relax her brow, but she'll still be able to express some emotion.
That's a good thing.
So that's animation. Now what about deflation? You're out of the balloon. That nice soft tissue envelope that we have on our 20s and 30s tends to fall, and you get the mouth frown, what's called the marionette line or the smile lines, and they're natural too, so we never want to get rid of them. We just want to soften them. And then we tend to use products like Juvederm, which is a soft tissue sugar gel. The gel's kind of ingenious. It comes with a local anesthesia, so it freezes as it goes. So I warn patients they're going to be a little numb after we use this gel. So we'll see a little lift effect on her smile line right after this little treatment. And it only takes about a minute or so. The last thing we're going to do is use a little product here called Belkyra. And this is another interesting chemical. It's found in everybody's gallbladder. So it's called deoxycholate. It's released into your small bowel, ready to digest those lipids. This is a lipid digester. Very natural again. We take that little double chin that we don't like. We take our Belkyra. We just let it get stuck in the skin, and then we broke down the fats. So these fats are broken down into their normal constituents, which is a little bit of glycerol, a little free fatty acid. These are taken back to your liver where they're processed, and away they go. So another simple injectable for a common frustration, the double chin, which in this era of selfies, everybody sees a double chin now. And so
even Ziggy out first, and then we're going to do the light treatment. Perfect.
Okay, so again, we've done our Botox, done our filler, we've balanced her smile lines. They look a little softer. We're treating the upper part of the face. You see her cheeks popped up a bit, but nothing too drastic.
That is phenomenal.
So I'm putting a little bit of gel on. No one needs to wear any goggles in the audience. I brought a specific kind of laser that's very safe.
And what's this kind of laser?
This is called intense pulse light. It's one of the most common ways that we rejuvenate the skin. It helps with red discoloration, brown discoloration, small pores, all the things that that we can't always get with our skincare products. So we can just press ready, and we'll create a little flash of light. And that flash of light looks bright. There's no danger to your eyes. And that will go right into the skin and attack the things that we find unattractive about aging, and it gives that nice youthful glow. And so that would be an example of a photofacial.
Perfect. Okay, well, we'll let Ziggy's treatments sink in. In the meantime, we're going to take a quick break. Stay with us.
I've done facial acupuncture, and the pricing is actually less money per year than a face full of Botox for a year.
Well, welcome back to the Zoomer and our episode on aging gracefully. Before the break, Ziggy received a treatment from Dr. Steve Mulholland. So I got to ask you, Ziggy, how you feeling?
I feel great.
You do? That's it?
Yeah, I feel a little tightening, but no pain. I feel wonderful.
Okay.
Thank you.
So, no, thank you to Dr. Mulholland. So, Dr. Mulholland, at your clinic, you have both kind of these less invasive treatments, as we just saw you demo on Ziggy, and then you obviously do more aggressive sorts of therapies, if you will. I understand you brought some photos with us, just so we can see that actually a lot can be accomplished no matter the route.
So there's a young lady that took the first 2 rungs. This is just laser energy, a little bit of Botox, soft tissue fillers, and about 2 weeks later, she looks about 5 years younger. And
I'd say at least.
It's relatively simple to do that kind of thing. Going up the ladder of opportunity, you can do things with endoscopic surgery and lasers under the chin. This is an example of something that just is some fat grafting and then what's called smart lipo of a double chin, where the laser is not outside but put under the skin under local anesthesia. And again, you can really change the contour and the shape. Clearly, diet and exercise would be the first approach, but you never lose weight from where you want it. And then finally, those individuals that want to do surgery are still in the minority. In fact, 18% of all cosmetic medicine is now surgical. It used to be 60%.
Wow.
80% is all the things we just saw there, which is just minimum invasive things with almost no risk to look 5 years younger. But again, this is a lady I did on a television show in the United States, and she was about 68 here, and she didn't mind undergoing surgery, which required 3 to 4 weeks to recover. So I did a brow lift, eyelid jobs, upper and lower, cheek lifting, neck lifting, and about 3 months later, she looks a good 15 to 20 years younger. You can't have that type of transformation with the non-invasive. So where to jump on the ladder, where you're comfortable. The younger you are, the more likely you're going to start with less invasive things. And many people are just happy with looking 5 years younger and never having surgery, and that's okay. That's 82% of what people do now.
Totally, and it's more affordable too. Leah, being where you are, where you do like kind of the more au naturel approach, when you hear that there is something perhaps at a better price point, there is no downtime, it's just that, wow, you look different, it's refreshed, it's not obvious. Would you consider something like that? If not, what do you do?
Well, I like to try to do things before my clients do them. So if they ask me, well, Leah, have you done a filler or something like that? Yes, I have.
Right.
And I'm not because I wanted to, but because I want to
research, of course.
Experience it for the clients so I can tell them about it. So I have had Juvederm. What I've done also, because all of this is about experimentation, I've done facial acupuncture.
Okay.
There is no downtime. There are no side effects. And it actually really works well. It plumps up the skin. It produces natural collagen. I don't know how all this stuff works. And the pricing is actually less money per year than a face full of Botox for a year. And there are no side effects.
But I have to say one thing. If you do Botox, and this is just from my own experiments and experience, I should say, you stop using the muscles that are causing the wrinkles. So let's say you have Botox. Let's say Ziggy has had Botox today. She stops frowning.
And nobody wants to look angry.
No, and I think that that's a huge benefit. And it's almost addictive to the fact that once you start seeing that line come back, which is maybe 8 months later, 6 to 8 months, I am told, I'm just lucky it does not come back. I would say that the cost is definitely,
it reduces
more
over time.
Important.
Yeah, absolutely. Do you think it's, and I'll pose this to Vivian, do you think it's better to start younger, to push it off as long as possible?
I think there are a lot of other things when you're younger you should do first. Sunscreen, 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 and that's topical and easy to use, and I think that helps. I think that when you reach a point where you think that you are starting to look unhappy or angry or in a way that your skin isn't feeling as stimulated as it can be. Even through diet and exercise, there does come a point where you may get those lines. And if you're a happy person, you want your face to represent that, and your attitude if you're positive. And there are some expression lines, like Dr. Mulholland was saying, your smile lines, you want to keep those. Those are part of your personality.
Yep.
And if you're not an angry person, you don't want to look angry. So there are complementary things you can do.
Certainly, and we'll be talking more about the skincare complements to this as part of a larger aesthetic regime. I do want to pivot away from the clinical approach for just a few moments so we can talk about new, simple makeup techniques. I'm going to walk over to the demo station once more. We've got our makeup expert, Genya, and our lovely model, Catherine, who I should say, she's a makeover recipient. She's also my aunt. I'm the one who pitched her over here. This is one of the luxuries and perks of being the host of the show. We're going to get to know my aunt, Catherine, a little bit more in the next segment, but I want to ask you, Genya, you deal a lot with women in both television, but also as your role as a makeup advisor with Shoppers Drug Mart.
Yes.
Tell me a little bit about what you tell women who are looking to perhaps rejuvenate and, I don't want to say youthify, but, you know, freshen up their look.
A lot of the women who come in to see me aren't even sure what they need.
Right.
So I look at them and I get an idea in my own head of what I want to hide and what I want to bring forth. And then using colors from the color wheel, because it's all about the color wheel, I believe. Hiding the bad points, bringing out the good. I start working at them. And as I go along, I get inspired and create a masterpiece, if I do say so myself.
Okay, I love it. Well, you know, we're going to be watching Catherine actually transform over the duration of the rest of the show. We're going to start with, you can do the makeup on the face. I'm going to do the makeup. And then we're going to have you work on the hair as well. And then we're going to actually have Wendy at the table dress Catherine, kind of perk up her usual lovely, what should we call this, athletic look that she uses day to day to get her ready for maybe a date night. Can't wait to see the results, updating our wardrobe next on The Zoomer. Stay with us.
Women feel comfortable in black. As they get older, as you age, color is so important.